guys, so welcome back to our YouTube channel. Today we'll solve about 2017 AIAPGET question paper. Let's start. So question number 1. All of the following provide attachment of trapezius muscle except option first rib, second occiput, third clavicle, fourth scapula. So the correct answer is first rib. Question number 2. Sternal angle is a landmark for locating the level of options jugular notch, second costal cartilage, xiphoid process, costal margin. So the correct answer is second costal cartilage. Question number 3. Intraventricular septum of heart is supplied by options right coronary artery only, second left coronary artery only, third anterior part by coronary artery and posterior part by left coronary artery. Fourth, anterior part by left coronary artery and posterior part by right coronary artery. So the correct answer is fourth one. Anterior part by left coronary artery and posterior part by right coronary artery. Question number 4. Hepatopancreatic duct opens into which part of duodenum? First, second, third, fourth. So the answer is second. Question number 5. Bone divide of muscular attachments is options cuboid, cuneiform, navicular, talus. Correct answer is talus. Question number 6. Both glomerular filtration rate and renal plasma flow are increased by options constriction of afferent arteriole, dilatation of afferent arteriole, dilatation of afferent arteriole, hypoproteinemia. So the correct answer is dilatation of afferent arteriole. Question number 7. Isoelectric part of ECG that represent complete depolarization of ventricles is options PR interval, QRS complex, ST segment, T wave. So the correct answer is ST segment. Question number 8. Pulse pressure is options highest pressure measured in arteries, lowest pressure measured in arteries, decrease with decrease in compliance of arteries, increase with increase in stroke volume. So the correct answer is increase with increase in stroke volume. Question number 9. Which of the following statement is true about rods of Bradina? Options. Rods are more sensitive to low intensity light as compared to cones. Second, rods adapt to darkness before cones. Third, rods are most concentrated on fovea. Fourth, rods are primarily involved in color vision. So the correct answer is rods are more sensitive to low intensity light as compared to cones. Question number 10. While spinning to the left, the eyes of a dancer snap quickly to the left. This fast eye movement is known as options ataxia, aphasia, nystagmus, or pharynxia. So the correct answer is nystagmus. The protein casein is present in milk in the form of options calcium, caseogenate, lactoalbumin, lactoglobulin, lactose. So the correct answer is calcium caseogenate. Question number 12. Number of years of healthy life lost due to ill health, disability or early death is defined as options HALE, health adjusted life expectancy, quality adjusted life years, disability adjusted life years, Selvenius index. So the correct answer is disability adjusted life years. Question number 13. The standard reference insecticide aerosol recommended by the WHO consists of options pention, pyrethrum, rotenone, apate. So the correct answer is pyrethrum. Question number 14. Which of the following is not a variable? Question number 14. Which of the following is not a variable in Kapusome is scale for measuring socio-economic status. Options: education, occupation, family income, type of house. Correct answer is type of house. Question number 15. Indicator of a virulence of a disease is options: incidence rate, prevalence rate, case fatality rate, mortality rate. The answer is case fatality rate. Question number 16. Tattoo marks can be recognized even in decomposed body by the presence of pigment in options: epidermis, hair, muscle, lymph node. So the correct answer is lymph node. Question number 17. Speedballs are prepared from options: cannabis, heroin and cocaine, quercetin, lysergic acid, diethylamide. So the correct answer is heroin and cocaine. Question number 18. A 18-year-old college student presented with erythematous itching lesions on the wrist. On examination, papules and vesicles were noted in band-like pattern around wrist along with oozing. The most probable diagnosis is option: seborrheic dermatitis, herpes simplex, contact dermatitis, urticaria. So the correct answer is contact dermatitis. Question number 19. A 15-year-old girl gave a history of well-defined small circular pink scaly lesions on her back, followed by widespread papillosquamous eruptions, typically arranged in symmetrical tree-like pattern on trunk. There was no lymph node enlargement and no oral lesions. The most probable diagnosis is options: tinea vesicular, pityriasis rosea, lichen planus, pemphigus. The correct answer is pityriasis rosacea. Question number 20. A 56-year-old diabetic and hypertensive male suddenly develops weakness of the left side of his face along with his weakness of right arm and leg. He also has diplopia on left lateral gaze. Identify the size of lesion. Options: right side brainstem, left side brainstem, right cerebral hemisphere, left cerebral hemisphere. So the correct answer is left side of brainstem. Question number 21. A 55 years old female presented with repetitive severe pain for brief duration on right side of face, which started after exposure to cold. No other symptoms or physical signs were present. The most probable diagnosis is trigeminal neuralgia. Question number 22. Which of the following is not the feature of Graves' disease? Options: goiter with grit, sinus bradycardia, exanthalamus, atrial fibrillation. So the correct answer is sinus bradycardia.